Welcome to the Bronchiectasis and NTM Association podcast, where we're here to share valuable insight from leading health experts, heartwarming stories from people living with bronchiectasis and NTM lung disease, and the latest in health research and treatment. Please subscribe, follow us on social media, and visit bronchandntm.org to learn more. Just a quick note before we get started. This podcast series is intended for educational purposes only and is not suitable for medical advice. Please consult your medical provider if you have any questions. Welcome back to the Bronchiectasis and NTM Association podcast. Today we're going to talk all about appointments. So research consistently shows that individuals often forget a significant portion of information provided by their physician at their appointments, with studies indicating anywhere from 40 to 80% of medical information and recommendations are forgotten immediately, and of the information that is remembered, only about half of it is typically remembered accurately. So today, to answer all of our questions to help us prepare for appointments is Dr. MacRae, who is a valued provider within the Bronchiectasis and NTM Care Center Network. She is here today to help answer all of our questions about appointments and help you to be better prepared. So welcome, Dr. MacRae. It is a pleasure to have you. Could you just start by telling us a little bit about yourself and your work?
Thank you so much for having me. I'm so happy to be talking with you today. I am a pulmonologist as well as a critical care doctor. I work here in New Orleans at LSU and UMC. I am from Texas originally, and I moved to New Orleans to do my medical training. I did a residency and then a fellowship in pulmonary and critical care, and then stayed on over at LSU and have developed an interest in bronchiectasis and NTM. And that's the focus of all of my clinical care, all of my outpatient care, as well as my research. And I've had a lot of fun trying to grow our program here and being part of the Care Center Network.
So when you have new patients diagnosed with bronchiectasis and or NTM lung disease for the first time, what are some things that you notice about that first appointment?
I think a lot of what you said is so true. I think patients, of course, are coming into a new appointment feeling very anxious, maybe scared, maybe prepared for disappointment. Unfortunately, I think a lot of patients with NTM and or bronchiectasis, a lot of times they've seen other doctors or providers who maybe weren't able to answer all of their questions. And so I think that first visit is so important for establishing a relationship. And I think it's very understandable that patients are often coming in worried about what they're going to hear at that appointment.
How is this specialized bronchiectasis and NTM appointment different from traditional pulmonary visits? What should patients actually expect?
So I think it's going to probably be a longer appointment than most just kind of general pulmonology appointments. Some of that, of course, I'm sure gets limited, and different places are going to have different amounts of time. But I think for those of us who are in care centers, it's really important to have a nice long visit with a new patient. I usually spend about 60 minutes in the clinic, sometimes a little bit more, sometimes a little bit less. It's probably going to be a lot more detailed than some other appointments. Patients should expect to really probably go through your whole life story from a pulmonary standpoint. So symptoms from childhood to now and at whatever age that's happening, as well as what other doctors or providers they may have seen in the past, what kind of studies they've had done, what kind of treatments they received. So it's usually going to be a pretty long and sometimes maybe very detailed, even overwhelming appointment.
Should patients be prepared and come to their visit with specialized documents, test results, or even their medical history? Should they come with that?
That's always really helpful if patients are able to. More and more, medical systems are using the same medical record system, which means that more and more we're able to see each other's notes or visits, but sometimes that information still isn't translated. And there's still some hospital systems that aren't in that shared network. And so to get the most out of that first visit, I would ask for patients to come as prepared as they can be. So if they could even jot down, oh, these are some antibiotics I've taken in the past that have worked for me, or these are kind of what my symptoms have been like. If you have access through a patient portal or a MyChart, that can be helpful in case the provider that you're seeing doesn't have the same access to see outside records. And a big thing that I always ask of new patients is, if at all possible, for them to bring a CD with their previous CT scans or x-rays, because it can be very helpful to be able to look at the imaging myself, not just go off of a read from another radiologist.
Do you typically have them redo the CT when they're in the office, or do you have them start with any specific, tests or assessments that you talk about during the first visit?
A lot of it is going to vary depending on what kind of tests they've already had done. If someone's had a recent CT scan, I typically would not repeat it unless in some specific situations, maybe it was a non-contrasted CT and we need a contrasted CT, or very, very technical reasons that sometimes we would repeat it. But if we have access to see that CT scan, typically we can review that and go off of it. And that's why, if you know that you're seeing a doctor or a provider who's in a different hospital system than all of your imaging has been done, if you can just bring a CD-ROM of that scan with you, that can be really helpful. All of the other tests, so common tests that are ordered for patients with bronchiectasis, would be pulmonary function testing, maybe a 6-minute walk test, some blood work, and as well as microbiology tests. Usually that's testing sputum. A lot of that is probably going to be repeated at the new center that you're going to, but we want to reduce repeating imaging unless it's absolutely necessary.
So when you say recent, would that be within the last 6 months, within the last year, within the last month? What kind of time frame would recent be?
Great question. And there's actually not currently a consensus in the community for just how often should we be repeating CT scans on patients. So a lot of that's going to vary. I would say if you have a CT scan within the last year, that's going to be very helpful. And in terms of more frequently than that, for me, it kind of depends on each patient. It depends on whether symptoms are changing or stable. It depends on whether I'm actively treating them for an infection or just monitoring. There are some patients who get CT scans more frequently than every year. There's some who it's every year. It's going to kind of vary, but I would consider within a year to be at least relatively recent scan.
When we look at, a clinic, many centers use some sort of team approach. How likely are patients to see multiple specialists or different healthcare providers during their first visit? And what is the benefit of seeing these?
I think when those resources are available, it can be very helpful. A lot of that is going to vary from center to center. Each center is kind of reliant on our hospital systems, or if we're associated with the university that we're associated with, support for the team approach. So sometimes patients should be prepared to see a lot of different team members, maybe even multiple physicians or providers, a pharmacist, a respiratory therapist, a social worker. And then some, it may just be that you're seeing the one doctor, the one provider. A team-based approach can work really well as resources are available, but I don't know that there's a standard that a patient can expect to walk in on.
Mm-hmm. So aside from having the lung specialist, other team members that a person might see would be maybe a respiratory therapist, a nurse, a pharmacist, registered dietitian, social worker, anybody else that you can think of that might be utilized?
In some programs, they may see just a pulmonologist. In some, they may see just an infectious disease doctor. In some, they may see both. So there may be other types of specialists. But other than that, I think that what you said is kind of the maximum team members who are involved, with probably the most common being a respiratory therapist, which can be very helpful to help with instruction on things like airway clearance therapy when that's available.
What advice do you have for patients who might feel really anxious or unsure of what their appointment is going to entail?
Have a lot of advice. I think one piece of advice that I would have is to remember that this is a chronic illness. So bronchiectasis is a chronic illness. Now that can be scary because that sounds like it's going to last for a long time, but it also means that we don't have to figure everything out on day one. And I think that first appointment is really important for just establishing your relationship with your provider, making sure that you feel like your provider is hearing you and really getting your history down, explaining things to you, and that you feel like this is a relationship that you could have for probably years to come. I think having that connection is really important when this is someone that you're going to probably be seeing for such a long time. Hopefully, the patient will remember some of what's talked about, but I also think that this is going to be a long relationship with lots of different visits. And so it's okay if you're thinking, oh my gosh, I'm not going to remember everything that they're telling me today. That's okay. We can go over things again at the next appointment. Or maybe today we're talking a lot about bronchiectasis, and maybe tomorrow, not tomorrow, but the next appointment, we're talking about NTM, non-tuberculous mycobacteria. Not everything needs to be addressed in that first visit. And I think what's most important for that first visit is just to really establish that relationship and to make sure that you feel heard and supported. And a lot of times, as a doctor who's frequently seeing people on our first visit, I may not have a lot of the answers on that first visit because I may need a lot more information before I can answer a lot of questions that patients might have.
So would you say preparation for these appointments to help with anxiety would be really helpful? So like writing down your questions and your concerns beforehand. Do you often see that people bring maybe family members or friends to be there for support?
I think both of those are fantastic pieces of advice. So I think when patients come to me and they've written down their questions, that is super helpful because as we're talking, again, I usually try to have about an hour-long visit for that first visit. We may talk about so many different things. It can be so easy to lose your train of thought and forget the questions that you came with. And so I think if you know that there's a set of questions that you want answered, it's really helpful to come with that written down. I would say usually it's most helpful to ask those questions toward the end because a lot of them may be answered just from the conversation. And then I also think whenever possible, it's very, very helpful to have a friend or a family member or just someone who's supportive in your life to come with you. They can help think of questions that you haven't thought of and just help absorb some of the information that you might forget and be able to process everything afterwards.
When a patient has their first appointment, do you guys typically go through the same process with everybody? Like, so could they call and ask, what is this process going to be like? What can I expect?
I think that would be a great idea and really helpful. Often that conversation is probably going to be with a nurse or a medical assistant or someone who works in the clinic staff. I do, for example, my wonderful nurse who helps support me in my clinic, before talking to patients about a new appointment, she will, of course, give them instructions for how to get to the clinic, talk to them about parking, but also let them know, hey, Dr. MacRae would really appreciate if you can bring a CD of your CT scans if you have it, or bring prior medical records. So if you're not getting that call, I do think it would be helpful if you can reach out to the clinic and say, hey, is there anything that you need? Is there anything that I should bring that would be helpful for this first appointment?
And then also one thing I would recommend too is just plan your visits so you don't feel that you're rushed. You don't want to be rushed through these visits and feel that you have something on your to-do list afterwards, because you really want to be in the right state of mind to absorb all that information. And going back, 40 to 80% of the information that we hear is actually forgotten immediately, and only half of what is remembered is recalled correctly. So just to try to be in the right frame of mind and to not feel that you have something on your to-do list after your appointment.
100%. I think a lot of patients also travel pretty far if they're seeing a bronchiectasis or NTM specialist. Of course, we're working on expanding the care center network right now, but a lot of people have to travel relatively far to see a specialist in this. And so I think just kind of planning for that to be a long visit, I think you're exactly right, Alyssa. I think that's helpful. And if you're often, providers are going to run late. I'm often running late because I like to spend a long time with my patients, which means that I may be running late for the next patient. But that visit, that first visit especially, deserves a long time. And so I think I completely agree with you. Don't plan it on a day that you have a meeting or, something to do right afterwards, because you may not get as much out of it.
And then after the appointment is over, do you have any recommendations for what a person should do after the appointment?
I think that it could be really helpful after that appointment. Maybe you're driving home. Again, hopefully, if you had someone who was able to come with you, y'all are talking about everything. I think if at all possible, it'd be really helpful to actually jot down questions then. You don't necessarily have to reach out and ask those questions right away, but just while everything's fresh in your mind, maybe write down those questions or open up a note in your phone and put them down so that the next time that you see your bronchiectasis specialist, you can say, hey, after our last visit, I thought of these 5 questions that I didn't think of from the first time, because chances are the next time you see them, maybe in 1, 2, 3 months, you may not remember all of those questions that were really fresh. And then I do think, again, living with a chronic illness like bronchiectasis, I always tell people, this is not an original analogy. People say this all the time, but it really is. It's a marathon, not a sprint. And so I think just giving yourself grace, giving your team grace, that it may take a while to get answers. It may take some more testing to come up with the long-term plan, and plans may change as your symptoms change. So just trying to give yourself, your body, your lungs, and your team some grace that it may take some time to figure everything out.
Mm. You mentioned before being part of the Care Center Network. Could you just tell us what the Bronchiectasis and NTM Care Center Network is and how it really helps to support patients?
Gosh, the Care Center Network has been such a huge and exciting win in the world of bronchiectasis and NTM, as I'm sure a lot of patients who've had these diagnoses for a long time know. Having access just to know which providers really know about this, who really is a specialist or an expert in this, what information can I trust, what information isn't so good. That's been really hard for a number of years. And so the Care Center Network has a pretty extensive application process, as it should, where centers who have people who have a special interest or specialize in bronchiectasis and NTM, and also have all of the resources that are needed for these complicated diagnoses, can apply to the network and then receive this designation, which means that a team of experts have reviewed the application and kind of vetted the system to make sure that this really is a clinic or a center that has the resources that patients need. Again, this first iteration of the Care Center Network, the first centers were recently chosen. They're working on the second group, and the idea is just to expand this so that the access is more available. But being part of the Care Center has been fantastic in terms of access to resources for our patients. There's a lot of different informational pamphlets, flyers, handouts that we're able to give, which can help with some of that information that you may not retain after that first appointment. And as the care center network, we're constantly working on trying to improve all aspects of bronchiectasis care, education, outreach, support, all of that.
Thank you so much for joining us today, Dr. MacRae. We really appreciate your expertise in helping to quell some of that anxiety and feeling of overwhelm during that initial appointment.
Absolutely. Thank you so much for having me.
Thank you for tuning in to the Bronchiectasis and NTM Association podcast. We hope that you found today's episode helpful and inspiring. You can stay connected by joining our online community, following our social media, and visiting our website for more resources. And of course, subscribe to this podcast and join us next time for more insights, stories, and tips to help you live well with bronchiectasis and NTM lung disease. Until then, thanks for listening and be well.